If you looked into regenerative medicine, exosomes, PRP, stem cells, peptides, you've probably heard two completely opposite things. On one side, influencers telling you it cures everything. And on the other side, doctors telling you it's all snake oil. Both of these positions are wrong. And the fact that you're stuck in between the hype and dismissal is the reason most people either waste money on the wrong treatment or miss out on something that could genuinely help them. In the next few minutes, I'm going to tell you what regenerative medicine actually does, what it doesn't do, and how to know if it's right for you. No hype, no agenda, just what I've seen in 20 years of practice. You've seen the Instagram ads promising total joint regeneration. You've heard your doctor say there's not enough evidence. And now you're stuck. You want to try something new because the old approaches haven't worked, but you also don't want to throw thousands of dollars at something based on a celebrity endorsement. That confusion isn't your fault. The information landscape around regenerative medicine is broken. I'm Dr. Sudhir Rao, triple board certified in pain medicine, anesthesiology, and functional medicine. I run both a chronic pain practice and a regenerative medicine center. I use PRP, exosomes, and peptides with my patients regularly. And I also tell patients when these treatments are not the right fit. That honesty is what this space is missing. I'm going to break down 5 truths about regenerative medicine that cut through both the hype and the skepticism, so you could finally make an informed decision instead of a confused one. Point number 1, regenerative medicine is real science, not alternative medicine. The first thing I need to clear up is the idea that regenerative medicine is fringe or unproven. Platelet-rich plasma has been studied in clinical trials for over 2 decades. Exosome research is published in peer-reviewed journals at major universities worldwide. These are not essential oils or crystals. These are biologically active treatments that work with your body's own repair mechanisms. The science is real. What's also real is that science is still evolving, and that nuance is where most people get lost. Here's the part that frustrates me as a physician. The same medical community that embraces brand new pharmaceutical drugs with only 2 years of data will dismiss regenerative therapies that have 20 years of published research. That double standard hurts patients. PRP has strong clinical evidence for conditions like knee osteoarthritis, tendon injuries, and certain types of joint pain. Multiple meta-analyses show meaningful improvements in pain and function. Exosome research is earlier stage, but shows compelling results in reducing inflammation, supporting tissue repair, and modulating immune response. These aren't theoretical claims. These are findings from published peer-reviewed studies. Think of regenerative medicine like the early days of minimally invasive surgery. 30 years ago, the idea of operating through a tiny incision with a camera was considered experimental and risky. Today, it's the standard of care. Regenerative medicine is on the same trajectory. The question isn't whether it works. The question is which specific applications have the strongest evidence right now, and that's what the rest of this video is about. If anyone has told you there's no science behind this, ask them specifically, which treatment are you referring to, and have you reviewed the literature on it? That one question separates informed skepticism from blanket dismissal. So the science is real, but that doesn't mean every claim you see online is real. And this is where the second truth gets uncomfortable for a lot of people in my field. Point number 2, most of what influencers promise about regenerative medicine is exaggerated. I believe deeply in regenerative medicine. I use it on myself and with my own patients. And I also believe that the overpromising happening on social media is one of the biggest threats to the field's credibility. When someone on a podcast says peptides will reverse aging or exosomes will regrow your cartilage in weeks, they are doing more harm than good. Not because the treatments have no value, but because they have unrealistic expectations lead to disappointed patients who then dismiss the entire field. The practitioners who oversell results are not just misleading you, they are making it harder for credible doctors to offer these treatments without patients assuming it's all a scam. I've had patients come to me after spending thousands of dollars at a clinic that promised complete pain elimination with one exosome injection. No evaluation, no imaging, no lab work. Just an injection and a credit card charge. When the results didn't match the promise, they wrote off regenerative medicine entirely. That's a tragedy, because with proper patient selection and realistic expectations, the same treatment might have genuinely helped them as part of a broader plan. It's like someone selling you a hammer and telling you it can build an entire house by itself. A hammer is a real tool. It does real work. But if someone tells you it replaces the foundation, the framing, the wiring, and the plumbing, they're not selling you a tool anymore. They're selling you a fantasy. Regenerative treatments are powerful tools. They are not the entire toolbox. Before you invest in a regenerative treatment, ask the provider 3 things. What specific condition are you treating? What does the evidence say about this treatment for my condition? And what else needs to happen alongside this treatment for me to get the best result? If they can't answer all 3 clearly, keep looking. Now you understand the real science and the real hype. But there's one regenerative therapy that's getting a massive amount of attention, and I want to set the record straight on what it actually does. If you're finding this helpful and you want a doctor who gives it to you straight instead of selling you a dream, subscribe to this channel. I put out new content regularly that cuts through the noise on pain, longevity, and regenerative medicine. Now, let me tell you about the treatment everyone's talking about. Point number 3, exosomes are not stem cells, and that distinction matters. If someone told you exosomes are basically stem cells, they either don't understand the science or they're hoping you don't. Exosomes are tiny vesicles released by cells that carry signaling molecules, proteins, and growth factors. They act as messengers that tell other cells how to behave. They are not cells themselves. They do not divide. They don't grow into new tissue. What they do is communicate instructions for repair, reduce inflammation, and modulate immune responses. That's genuinely powerful, but it's a different mechanism than what most people imagine when they hear the word stem cell. Stem cells remain highly regulated and are difficult to access in the United States. In my practice, I use exosomes for patients with specific inflammatory and degenerative conditions where the signaling benefits make clinical sense. I've seen patients get meaningful improvement in joint and nerve pain and help them with recovery and improve inflammatory markers. But I've also turned patients away when their condition wasn't a good fit for exosomes. The difference between a good outcome and a wasted investment often comes down to a patient's selection, not the treatment itself. Exosome therapy may be worth exploring if you have a condition driven by chronic inflammation or tissue degeneration. You've already tried conventional treatments and gotten partial but incomplete results. You're looking for something that works alongside your existing plan, but not as a standalone miracle. Exosome therapy is probably not the right fit if you're looking for a one-time fix that replaces everything else. Nobody's evaluated your inflammatory markers, hormones, or other metabolic issues first. The provider offering it hasn't done a thorough assessment of your specific condition. That distinction between who it helps and who it doesn't is the difference between medicine and marketing. So now you know what exosomes actually do, but there's a bigger principle behind all of this that applies to every regenerative treatment, and it's the one thing I wish every patient understood before they spent $1. Point number 4. Regenerative medicine only works when your body is ready to regenerate. You can inject the most advanced regenerative treatments on the planet, but if your body's internal environment is working against you, you're throwing money into a broken system. This is the piece almost every regen medicine clinic skips entirely. Your body's ability to heal, to respond to PRP, to utilize exosome signaling, to benefit from peptide therapy depends on the environment inside your body. If your inflammation is sky high, if your hormones are depleted, if you're nutrient deficient, if you're not sleeping, your regen capacity is compromised. Injecting a biological treatment into a depleted system is like planting seeds in dry soil. The seeds aren't the problem, the soil is. This is exactly why I want to run advanced labs before recommending any regen protocol. I want to know what the soil looks like. Are your inflammatory markers elevated? Is your testosterone or estrogen tanked? Are you deficient in vitamin D, magnesium, or B vitamins that are critical for tissue repair? When we optimize the internal environment first and then layer in regenerative therapies, the results are dramatically better than when we skip that step. Here is what to stop doing. Stop walking into a regen med clinic and agree to treatment before anyone has assessed your overall health. And the first conversation is about what they're going to inject and not about what's happening inside your body. That's a red flag. Here's what to start doing. Before any regen treatment, request a comprehensive metabolic and inflammatory workup. At a minimum, ask for HSCRP, a full hormone panel, vitamin D, magnesium, and a fasting insulin. These markers tell you whether your body is in a position to actually use what you're giving it. Now, I've given you the framework for thinking about regenerative medicine the right way, but I want to leave you with one concrete thing you can do tonight that brings all of this together. Point number 5, the 3-filter decision framework you can use tonight. You don't need to become a scientist to make a smart decision about regenerative medicine. You need 3 filters in 5 minutes. The reason most people either get burned or miss out on regenerative medicine is not a lack of information. It's actually a lack of decision framework. They're making emotional decisions driven by either desperation or fear. What I'm about to give you removes both of those from the equation and replaces it with clarity. Think of it like buying a house. You wouldn't just walk into the first open house and hand over a check because the kitchen looked nice. You'd inspect the foundation, check the roof, review the neighborhood, and make sure the house matched your actual needs. Regenerative medicine deserves the same diligence. The treatment is the kitchen. Your body's readiness is the foundation, and the provider's credibility is the neighborhood. Tonight, open up your notes and run any regenerative treatment you've considered through these 3 filters. Filter 1, the evidence. Search the specific treatment and your specific condition together. Not exosomes benefits generally, but exosomes for knee osteoarthritis or PRP for lumbar disc degeneration. If you can find published studies and clinical trials for your exact situation, that's a green light to explore further. If you can only find testimonials and ads, proceed with caution. Filter 2, the environment. Write down your current health status honestly. Are you dealing with high inflammation, hormonal issues, poor sleep, excessive weight, or nutrient gaps? If yes, those need to be addressed before or alongside any regen treatment, or the treatment is unlikely to reach its full potential. Filter 3, the provider. Has the provider done a full evaluation of your condition before recommending a treatment? Can they explain why this specific treatment fits your specific situation? Do they have a plan for what happens alongside and after the injection? If the answer to any of these is no, that tells you something important. Run those 3 filters tonight. Write down your honest answers. If all 3 come back green, you have a strong foundation for a real conversation with a qualified provider. If any come back red, you know exactly what needs to happen first. The framework works because it replaces hope and fear with structure. It doesn't tell you yes or no. It tells you whether the condition for a good outcome are actually in place. And that's the difference between an informed patient and a vulnerable one. I'll leave you with the final thought. Regenerative medicine is not magic, and it's not a scam. It's a real evolving set of tools that, when applied to the right patient in the right context with the right preparation, can produce results that conventional treatments alone cannot. The key is approaching it with clarity, not desperation, and now you have the framework to do exactly that. If this shifted how you think about regenerative medicine, go back and watch the video I did, What 20 Years Ago and 20,000 Patients Taught Me About Chronic Pain. It lays the full foundation for understanding why root cause medicine matters, and it connects directly to everything we covered today. Click right here or check the link in the description, and I'll see you there.